Can't get enough of the Black Eagle? Check out www.joemadison.com for links to his Facebook, Twitter, and more.
And let me welcome my two guests in the spirit of bipartisanship. And boy, do I wish we had more of this. And hopefully this is a beginning. But this is a topic that transcends everything: gender, race, ideology. And it's about our country's inadequate mental health system. The Affordable Care Act has significantly, we know, increased insurance coverage for mental health care. So let me start my first question with Congresswoman Eddie Bernice Johnson, and also say thank you to Congressman Tim Murphy, Republican from Pennsylvania, for joining us. So let me ask, why the Help Families in Mental Health Crisis Act? Why is that necessary if the Affordable Care Act has increased insurance coverage for mental health care, Congresswoman Johnson?
Well, the problem really started a number of years ago, before we had a lot of homeless, as a matter of fact, when there was a Supreme Court ruling that patients that were housed for mental illness had to have access to treatment or be discharged. And many, many people who were in state institutions were discharged, but we didn't have a good follow-up system, and that has continued. And they became chronically mentally ill, having actually no place to go except to the jails, and housed in homes and roaming the street and making up the bulk of the homeless population. And so it has become very necessary to look specifically at this population to see where we can make an innovation. Because Medicaid, as you know, most chronic mental illness is long-term. So no insurance company and no other program really want to welcome chronically mentally ill people into their system because they think it'll take too long and cost too much.
Representative Tim Murphy, and again, thanks for being on the Madison Show. Your bill addresses that the government is spending billions, and we know this, on mental illness treatment. But the question is, are we getting results? From what I've read in the Washington Post, supposedly your bill will at least help make sure that we do get the kind of results that this money should get. Can you expand on that? Representative Murphy?
Yes, and it's good to be with you today. Yes, what happens is that...
Yeah, thank you. Hi, how are you?
I'm doing great. Basically what happens is there's so many things that people just can't access because it's not there. As Representative Johnson was saying, unfortunately what happens, particularly for minorities, is their access to the mental health system doesn't really start till they get arrested or in jail or in homeless programs. We don't have enough psychiatric hospital beds where they can get real treatment. Medicaid has some rules where you can't see two doctors in the same day, which is very important because many times the symptoms of severe mental illness begin when someone is a teenager. And if they say, well, you can't come, we need you to come back another day to see the psychiatrist or psychologist, that's just not helpful. So what we end up doing is spending massive amounts of money with people in jails, where somewhere between a third and a half of those in jail are mentally ill, and a bigger percentage of people with minorities end up in jail. They just don't have access to the mental health system. So even with the Affordable Care Act, the sad news, not enough psychiatrists, not enough psychologists, not enough hospital beds, and even some of the cultural barriers to treatment. We have to tear down those walls so people can get help and not just be put out in jail or homeless.
Congresswoman Johnson, could you talk about the bill also allowing, if I'm not mistaken, judges to order severely mentally ill people to go to undergo treatment? Because what happens now? Judges don't have that authority to do so?
Well, in some cases, yes, judges do. But there are some barriers now where it takes a great deal of family history, family determining that the persons are long-term ill. It really does have to have a bit more strength to give that power to the judges when the materials and the history has been given to the judge.
Do you have... Yes, go ahead.
There's a limited number of days of which they can get someone admitted
I see.
to a facility, and 3 to 4 to 5 days they have to let them go.
Congressman Murphy, you were going to add?
Yeah, I was going to add on that. What happens is what Representative Johnson is referring to is there's a standard that a person has to basically be imminent danger of harming themselves or someone else. And 45 states will have a standard that says they can still get them into outpatient treatment, even if not inpatient treatment. When you look at a case that occurred here in Washington, D.C., Aaron Alexis, who went to the Navy Yard and shot people up, he certainly had a lot of symptoms, hallucinations, delusions, a history of problems. But the concern was, can you get him compelled to be in outpatient treatment? One of the things our bill says is if a person is cycling through jails and in this revolving door of in and out of hospitals, but we know with treatment they can get better. On those rare occasions, and by rare I mean it's about 1% of 1%, a judge can work with the doctors, work with the patient, and say, look, we need to keep you in treatment here. Now, that doesn't mean someone's going to go to jail or anything if they don't get in treatment. But it's been found, for example, in New York State to be very effective, where they've reduced incarceration rates of the mentally ill by over 80%. They've reduced the homeless rates, or just going to emergency rooms, by over 70%. It is much more compassionate to offer a person treatment than to just have the police pick them up and take them back to jail. And we're trying to get that option, the freedom to be treated, the right to be treated, as opposed to just ship them off again and ignore them.
Now, let me again, I'm reading from an article that we pulled, and it says that this is interesting, that some patient advocates have opposed your approach, Senator Murphy, as coercive and harmful to those who need help. Quote, the government should not be expanding the system's capability to hospitalize or impose treatment on those going through severe episodes. It should instead be investing in community care that heads off the need for more serious treatment. How would you respond to those critics?
Well, those are false things. First of all, do we need more community care? Absolutely, and we have a number of things in our bill to do that. But what happens is there's a difference between those people who are aware of their problem and seek help and those who are unaware. And the medical term is called anosognosia, where someone does not realize that the symptoms of delusions and paranoia, hallucinations are not normal. They really believe the voices they hear, the FBI planting things in their brain, they believe they're Messiah. They believe that. That's real. And they also resist medication and treatment. If you look at these cases of recent homicides, and understand most people with mentally ill are nonviolent, but if you look at the cases of Adam Land, who did the shootings at Sandy Hook, Aaron Alexis did the shootings at Navy Yard, the recent ones with Elliot Rogers, who did stabbings and shootings in California. In every case, people knew they had problems, but they refused treatment. And what we're saying, in those rare cases, 1% of 1%, they need other compulsion to get them into treatment. Mm-hmm. So those who are saying we want to go back to days of asylums and forced care, that's absolutely untrue. I think they're playing on old fears there. We're recognizing that these people have a right to treatment, and society has a right to also feel safe. And compassion dictates in some cases, you know, if someone's refusing care, refusing the medication, in those very, very rare cases, keep in mind we're saying 1% of 1%, we ought to get them help, because the alternative, particularly for minorities, is going to jail or being homeless. And talk about being restricted. Jail and homelessness are the worst. I'd much rather get them in care.
You know, Congresswoman Bernice Johnson, as the congressman was speaking, I was thinking about the neighborhood where I live here in Washington, D.C., and it's just not my neighborhood. It could be many neighborhoods. We've seen them in Georgetown, Chinatown. You know, you can go anywhere around the country, and probably in your district too. The people who are homeless, they clearly have mental issues. There's a gentleman, I see him every day, and I feel compassion, and I say to myself, well, he needs help. Why can't he get help? This is sort of what, would you agree, that the congressman is talking about? Because I'm certain this is your district also.
That is exactly true. As a matter of fact, what many feel is that we are trying to bring back the old state institutions, because 60, 70 years ago there were probably 600,000 to 1 million people housed in institutions, in inpatient psychiatric beds. Today they are somewhere around 40, less than 50,000, which means that mental illness has not disappeared. It's simply people that are not getting the care that they deserve to get or should be available to them so they can live normal lives with treatment. It is not an effort to reinstitutionalize people, but it is an effort to attempt to get the chronically mentally ill people in some type of treatment modality so that we don't keep reading about families who've had adult people, children, in their homes that have been not immersed in society, talking to themselves, hearing things, responding to voices, responding to a tooth that has a chip in it, can get the help they need and not wait until there's a crisis.
You have two. I assume, and correct me if I'm wrong. I'm certainly familiar to some degree with Congresswoman Eddie Bernice's district, having been in and out, working sometimes in the district and knowing her for years. I assume, Congressman Murphy, you guys have two different demographics, two different types of districts, if I'm correct. So what brought you to this issue? What were your constituents primarily concerned about? Because most bills come about because of constituency concerns.
Well, what happened here is I represent suburban, post-industrial, and rural areas in southwestern Pennsylvania, south of Pittsburgh.
Okay.
But I'm a psychologist by training, and I still practice in the Navy as a psychologist. Representative Bernice Johnson was a VA psychiatric nurse. So what brought us together here is our common experiences. We're a rare commodity. In fact, I think I'm the only one still practicing as a mental health professional in the federal government, but it is something that we recognize because we've lived it, we know it. We've treated such people over the years, and the benefit of that is we know people with treatment can get better. Nothing is more heartbreaking, I think, than talking to a parent or a family member of someone whose life has faded away and deteriorated in and out of jails or hospitals or homelessness, and for the parents to be pleading, can't you get my son or daughter help, or my parents help, my brother or sister help? And we know we can do this. We're going to work on more resources. We're going to work on more providers. And that tiny part of the bill that also says that for some people we're going to make sure they get help. Keep in mind, when we're compelling people to get help, that also means the system has to get them help too. That means the providers can't run away from it. You know, isn't it amazing that a judge, when they order someone to jail, the state has to build more jail cells.
Right.
But there's nothing there that compels the state to get people help when they need it, when they can benefit.
Final question for both of you, and that is, since this is a spirit of bipartisanship, which I'm very pleased to help push and support. Who have you gotten many of your colleagues to sign on to this, or is this relatively new? And my show is always about asking my constituents to do something about it. So should our listeners be calling their members of Congress, telling them to sign on to this bill?
I would encourage them. Yes. Yes, I agree. So we're in total agreement.
Okay.
Yes.
And
we've got about 80 or 90 co-sponsors, and we need more.
Okay.
The legislative year is short. We need more.
Yeah. And finally, Congresswoman Johnson, same thing. I take it Congressional Black Caucus you're gonna ask that they get behind this, that the constituents sign on to.
Yes, we have a significant number of the caucus members. We'll continue to work until we get all of them. We are getting tremendous support coming from the mental health professionals and local authorities, from the police departments, the medical schools, all of the various entities that have contact, though sometimes fleeting contact, with these mental health crisis individuals that continue to plague every community.
All right.
It's not. We have probably less access as minorities, and minorities have come professionally, both Latinos and others, to support the legislation. But also, this is really pretty universal, where families don't have their own means to take care of the health care, the mental health care of chronically ill people.
I tell you what I will do. I've got a speech down in Orlando, Florida, this Saturday. A group of men and their doctors and pharmacists and folks in the in healthcare industry, and I'm going to take this information and I'll incorporate it in my speech and ask that they issue a resolution in support of this. It's titled the Helping Families in Mental Health Crisis Act. Is that correct?
Yes.
That's it. All right. Representative Tim Murphy from Pennsylvania, thank you very much. Always good to talk with you, and Congresswoman Eddie Bernice Johnson. Thank you very much for coming on.
Thank you very much, and thank you for having me.
Thank you.
All right, then. We'll continue here with Madison.